tonight, and it gets called a lot of things. And so there's something on it. We'll try to clarify that a little bit tonight, or what the official titles are. But this is an area that's very special to me, just in terms of the number of kids I see. A lot of my practice is around ADHD, but I also have an ADHD son who I have survived and been through events with, and I'll share a little bit of that with you, with his permission, to kind of help you understand what it's like living with the disorder and experiencing it and what goes on. As we go through, please feel free to ask questions, and then we certainly will have time at the end for additional questions. But the first idea that we will talk about is, what is ADHD? And ADHD stands for Attention Deficit Hyperactivity Disorder, and we'll talk a little more about the title in a little while. But it is a developmental disorder found in children and adults that is best defined as the inability to initiate and sustain motivation, attention, and behavior to successfully complete tasks, especially ones perceived as meaningless and boring. So it's not that you can't pay attention if you have the disorder, it's harder to pay attention. And there's certain things that's harder to pay attention to than others. If there is an immediate consequence, it is probably easier to pay attention. If there's no immediate consequence, if it is something that's fun and exciting, easier to pay attention to. If it's boring, harder. Obviously, everybody has this to some degree. All of us, ADHD, non-ADHD, can pay attention to something we enjoy much more than something we find boring. But these individuals have a greater difficulty than people who do not have the disorder. Notice also that one of the things that gets overlooked a lot is the inability to initiate and sustain motivation. When most people talk about ADHD, they talk about inattention and they talk about hyperactivity. And some people now will include hyperactivity / impulsivity. But it is, in recent years, we have determined it is a lot more than that. These kids really have trouble motivating themselves. These adults have trouble motivating themselves. You will probably hear me referring to kids because that's a lot of what I work with, and that's just an old habit. But I say I understand that adults experience the same thing. This is a very serious disorder, and you're going to see the impact of it later on in the presentation. We're going to talk about what are some of the consequences of it. And it's not a pretty picture that's painted. A lot of people think, oh, it's just ADHD. But it has some very serious ramifications and serious consequences. All right, so what are the major characteristics? Impaired response inhibition. And what this means is they have trouble inhibiting certain responses. If they think about doing it, they do it. You and I may have a filter and say it wouldn't be appropriate to stand up and yell something in a meeting like this. If they think about doing it, they may just do it, and the filter doesn't work. And so inhibiting response. And that's the reason that a lot of times you hear distractibility. In a lot of studies it shows that ADHD individuals really are not more distractible, but they can't inhibit these impulses that interfere with paying attention. And that's the problem. Impaired impulse control. very impulsive, and this is the thing with teenagers that creates a lot of difficulties and issues. Impulsive decision making. And that's the reason that there's a lot of concern about ADHD individuals getting behind the wheel of an automobile and making impulsive decisions. Again, it's not always the distractibility or the inattention, it's this impulsiveness. And this has just in recent years kind of become more of the cornerstone that people are looking at in terms of the disorder. Impaired capacity to delay gratification. This is a big end. This is one of the things that creates difficulties. The motto of ADHD individuals is, let me do what I want right now, kill me 10 minutes from now. They live in the moment. What happened 30 seconds ago is irrelevant. What's going to happen 30 seconds from now is irrelevant. And so living in the moment, they don't think about what happened the last time I engaged in this behavior and the trouble I got into. So they don't learn well from their mistakes. Also, they don't anticipate what's going to happen long term if I do this. If it's what I want to do right now and it's going to satisfy me right now, make me happy right now, then that's what I'm going to do. So you can see the difficulties that that's going to create in someone's life. Excessive task irrelevant activity. They have trouble staying on the task at hand. So, kid trying to do homework. So they sit down to do the homework. I'm thirsty, I need to go get a drink of water. So they go get a drink of water. Come back, sit down, 10 seconds. I gotta go to the bathroom. Come back, sit down, 10 seconds later. I need something to eat, I'm hungry. 10 seconds later. There's a dust ball, I think I'll play with it. And so you can imagine the frustration of trying to do something like complete a task that is boring when you have all this going on, because now, instead of taking 30 minutes, it's taking 2 hours to do this boring task. And so you get a very low quality, you get a lot of carelessness, a lot of mistakes made. Poor sustained attention. Again, it's not that they can't pay attention, it's trouble sustaining the attention. You give an ADHD kid, a lot of them, you give them a video game, they're good for a day. Nintendo figured out how to keep people focused. A lot of noise, a lot of visual change, immediate consequences. You push the wrong button, you die. The good news is you don't go all the way back to the beginning, you just go back a little way. The classroom would be a lot more attentive. But the video game people have really got an understanding of how to hook people. And that's the reason that it's so popular. Poor persistence of effort. A lot of times these kids will be accused of being lazy. It's really not. Many of the kids that I see, many of the adults I see, really want to do a good job. And they get frustrated with themselves. I went through this with my son, seeing it. He would come home and we worked out a planner that he had to keep track of his homework because he was very disorganization is another part of this, totally disorganized. You go and look in their desk and it's just, who knows what you'll find in there. You look in their backpack, just chaos. And so everything gets lost. But my son was very disorganized, so we got a planner and he had to do his planner. And so I would check it, or my wife would check it each afternoon. And so I can remember one night in particular looking at his planner Do you have any homework? Oh, no. I said, well, let me see your planner. So I look at the planner. I said, now, what's this math assignment? And you just see that look on his face where he had totally forgotten. And it wasn't that he was lying about not having the assignment. He had genuinely forgotten he had it. And that's the reason we had to do the planner. And so they get very frustrated. And a lot of ADHD kids, adults, will end up. And that's where you get real concerned. They just kind of quit trying. And low self-esteem, depression can become a part of all of that process. Additional characteristics. Remembering to do things. And working memory is a really important concept that we're hearing more about and understanding more. And what working memory is being able to remember things in a way that you can use them. And remembering to use them at the appropriate time. And this is probably the biggest deficit and the thing that we're having the most trouble with is creating the biggest impairment for ADHD individuals, and we have not figured out the best way to treat it yet. And this is the frustrating part. So let me give you an example of how this works. I had a young man years ago I was seeing, and had some anger issues. There was ADHD, had some anger issues. So we were talking about anger, and he could have taught an anger management workshop. Kid knew it, backwards, forwards, everything about it. Walks out of my office, into the parking lot, has a meltdown, and does not remember to use a thing we talked about. Now, if you ask him, tell me about anger management, he could remember it. So it's not a memory issue, it's a working memory issue. And so they can remember things, but they can't remember to use what they know. And that's where a lot of the impairment that we're seeing with ADHD and the ones that are having the impairment, this is the thing we're seeing is the biggest impact. And you can imagine you know something, but when it's time to use it, you don't remember to use it. Social skills. A lot of these kids can tell you exactly what they should do in each social situation, but when that social situation arises, they don't remember to use it. And so this is one of the big things that we're seeing with ADHD that's getting a lot of attention right now, that people are trying to figure out what we do with it. There's a lot of computer programs out there, and so far it looks like most of those programs improve memory, but they don't improve working memory. What happens with this is there's been a lot of things with a lot of problems. For example, EEG, electroencephalogram biofeedback. So we hook a kid up to an EEG, and you have two waves. One is associated with motoric activity or motor activity, and they're sky high, they're over here. Mental alertness, they're down here. And there's actually a set of data points that if this is greater than X, there's a 95% probability they're ADHD. So it's an assessment tool that's used. In the lab, we can get them where they're like this. But in the classroom, can't get it. And there's some studies now showing that even with behavior management, if we train kids in a certain place, in a certain environment, they don't remember to use that in a different place. And it's that working memory, and this is really a significant issue. Delayed self-talk resulting in poor self-regulation. You know, you learn to sort of talk yourself through things. Remember what happened last time you did this. You need to stay calm. Losing control is not going to help you in this situation. And we talk ourselves through that. Well, these individuals do not do a good job of contemplation and certainly very poor self-regulation. Difficulty with regulation of emotions. We're starting to see more and more research showing the difficulty that ADHD individuals has with emotions, anger, so forth and so on. And then finally, diminished cognitive flexibility. They can be very rigid. It can almost look like OCD. And they can't shift gears very well. They get one thing on their mind and have difficulty shifting gears. And so cognitive flexibility is very important for problem solving. A good problem solver is going to think of many options and then evaluate. Well, these individuals, ADHD individuals, think of one, maybe two at the most, and that's what they're going to react on, and so they're very poor problem solvers in that sense. Other additional characteristics is variable performance across situations. One of the things that I will do in terms of assessment is I will try to get like FCAT test and look at it through the years. And one year, math will be high, reading will be low. Next year, reading will be high, math will be low. Next year, they'll be even. And you just get this variability, and it's not a true reflection of reading or math skills, it's a reflection of how well they paid attention that day to the questions and so forth. And so you get this variable performance. One day they may remember all these great skills they have, and the next situation they may not remember. Immaturity. Russell Barkley says that in severe ADHD individuals, and Barkley has probably done as much research on ADHD as anybody, says if you take a third of the chronological age and subtract that from the age of the individual, that's about where they're going to be emotionally and socially. So if you take a 12-year-old, subtract 4, it's going to be around 8 or 9 in terms of the social maturity. So they're late bloomers in terms of development. Early onset of major characteristics. When we're doing diagnosis, looking at has this started before generally age 7. ADHD is not something that all of a sudden just pops up. Now, with that said, I think you can have a very bright individual who is very difficult to diagnose in early elementary school. They can pay attention 65% of the time, and because they're smart enough, they can sort of fill in the holes, and so it won't show up very much. And so you may not see it till 4th, 5th, 6th grade, where the information starts to get more complicated, more abundance of information, and it becomes more difficult to fill in the gaps just because you're smart. And chronic course across development, and we'll talk a little more about the course of development, but it is basically a lifelong disorder for many people. Adult ADHD. There are a lot of adults who will maintain it. We'll look at some numbers on that in just a few minutes. Underachieve academically and vocationally, frequently change jobs, relationship difficulties, and with that you see more divorces, remarriages, divorce again, and more traffic citations and accidents. More accident prone, traffic accidents, speeding citations, things like that. And so even with the adult ADHD, and some of the numbers is like 50 to 80% of children will continue to have some symptoms into adolescence. And then about 50 to 70% will have some symptom that creates an impairment in adulthood. So the numbers are pretty high in terms of ongoing. Talking about my son, I was telling Don earlier, he's in his 3rd year of seminary, and he told me, I guess it was probably a couple months ago, he says, you know, Dad, I was thinking the other day, I don't think I've ever read a whole book. You're in your third year of seminary and you don't think you've ever read a whole book. One of the things we see is with this, underachieve academically and vocationally. Difficult to sit down, focus. He's very smart. He's smarter than I ever thought about being. But grades through college. He did well in high school because we kept him on medication and monitored his organizational skills, and that's the key. That's a lot of what you need to do, and we'll talk more about that in a few minutes. But he went down to the University of Central Florida on a scholarship and came home first semester. Had a great time, played a lot of football, but didn't study a whole lot. And he wasn't doing bad stuff, he wasn't getting in trouble. He had a reputation of being the yoo-hoo guy at parties, apparently, because he would take yoo-hoos and drink them. Never quite understood that. So all the other people would say, well, I can outdrink anybody in the room except the yoo-hoo guy. So it is very frustrating, and he became frustrated. Fortunately, he was wise enough to say, I need to come home, and I said, do you think you've learned your lesson? It's a pretty significant consequence. And he said, I can tell you that I have, but I haven't. I need more accountability. And so he came home and went to UW. Finally graduated, but his GPA was nowhere near what it should have been. And, you threaten, you bribe, not really bribe, because bribery is paying somebody to do something illegal. So, but you try to reward, you try all kinds of things, and it's just very difficult for these individuals to motivate themselves. I have a daughter who was very easy to motivate, and very strict disciplinarian with both high expectations. With my daughter, when she was in high school, she made up her bed every morning before she went to school. I was going to do the same thing with my son. After 3 weeks, we gave up. It was too much trouble. I mean, it was a battle all the time. And he was smarter than she was. She, in high school, made a D in Algebra 2 and got no consequences. He made a C in Algebra 2 and was grounded. She was studying, getting help, going in early, getting her teacher to help. Teacher told me, she said, I've never had a student work harder. She just didn't get it. He did probably 2 homework assignments at home in the 9 weeks he got the student. So he got the consequences, she did. So it does carry over into adulthood and becomes very frustrating to try to function effectively, and it's not just, I want to be lazy, I want to take shortcuts, I want to do well, but I find a hard time motivating myself to do it. So what do we call it? There's been a number of names historically. My favorite is jumping Frenchman's disease. This was back in the 1800s in France. And probably what they were describing was ADHD. And then we called it hyperkinetic disorder, hyperactive disorder. Minimal brain dysfunction was thrown in there at some point. And then we finally decided on attention deficit hyperactivity disorder. Combined presentation means you have the hyperactivity, impulsivity, and the inattention. Then predominantly inattentive presentation, and then predominantly hyperactive impulsive. And then you rate it as mild, moderate, severe. So that's the official diagnosis that we use now. Some people, like Russell Barkley, wanted to rename it and call it response inhibition disorder, which is probably the best description of it. But we've changed the name so many times, people said, no, let's just leave it the same. I want to talk a little bit about the inattentive type rather than the typical hyperactive impulsive type. So it's often referred to as ADD. There's less research on it. A lot of daydreaming. This is the kid that's often described as just kind of lost in a fog. They're just kind of sitting there and they're not disruptive, but it's just like they're not there. And very sort of appear to be sluggish, slow. A lot of times the estimation of their cognitive function is actually lower than what it really is because they appear to be slow. And there is even articles you will see now, and they're calling it sluggish cognitive tempo, SCT. I don't like that name, and I think most people don't like that name. It just sounds like you're slow, and I don't think that's going to stick around very long. Barkley recommended concentration deficit disorder. The mental alertness, easily bored, and they'll almost get drowsy. Very inattentive, socially quiet, almost lethargic. And these kids oftentimes sort of slip through the cracks. Because they're not disruptive, they're not up out of their seats running around, they don't get in trouble, so they don't get the attention drawn to them the way the hyperactive kid does. And so these kids can actually fall through the cracks. Inconsistent retrieval of information from memory. And it's hard to know how well it's stored versus the retrieval process. The treatment for this, and we really have very little research on it. There's only modest gains with stimulants, but this group appears to respond better to low doses of stimulants more than the ADHD hyperactive type. They tend to do better with the lower doses. And there's a lot of research showing up now that shows that antidepressants may actually work with them because it seems like some of these kids may experience some degree of anxiety and depression along with it, and so the antidepressant may actually help that. And the bottom line is much more research. We have a lot more research on the hyperactive type than we do this. All right.
Do you prescribe both the stimulant and the depressant at the same time?
Some people do. Yeah. If you have,
Because the stimulant is really acting counter to what you would expect in the pediatric patient.
right. Well, even in adults, I mean, and there's a lot of theories about why stimulants work with ADHD. And the theory is that there's parts of the brain that just do not fire as quickly, and particularly have to do with sending out messages. And so it doesn't send out the message, remember what happened last time you did this, or you need to stop and think about this, and those messages don't get out, and so the stimulant speeds those message centers up. That's the theory behind it. And you know, it used to be that a lot of kids, when they reach teenage years, will outgrow it, and so when I first started this, people would stop giving stimulants in the teenage years because they would think it would have the reverse effect. That was a theory more than evidence, and it really doesn't. A lot of adults will benefit from the stimulants. But I've had a number of kids
And
who
the
have...
stimulants will act as a depressant, and that if a patient is diagnosed ADD, that if you give them amphetamine, then it's, or Ritalin, one of them, it will work reverse than what you would think.
Yeah, it apparently speeds up these message centers so they get the message. The question was, does the stimulants have kind of a reverse effect of what we would expect in adults? And the answer is yes, that even in adults, the stimulants, and there's a lot of physicians that are reluctant to use the stimulants with adults because of addiction issues and so forth. But there's a lot of mixed evidence, and there's some studies that suggest that kids who don't get treated with the stimulants are more at risk for substance abuse issues than those who do, because they end up self-medicating. You know, if they're getting in trouble and so forth, then they self-medicate to deal with that, or if they get with a peer group who's also using, and so the risk actually increases. And we'll talk more about the medication issue in a moment. Yes?
I teach exceptional education, and a lot of times parents will not put their kids on medication, but they'll give them a couple of cups of coffee in the morning. And we had one mother that wanted the child to drink Mountain Dew. The problem was she didn't give the child diet Mountain Dew, so the sugar kind of made an effect. But we have so many that aren't treated. But
yeah, non-compliance with treatment is a huge issue in this population. Very large issue. And there's no evidence that caffeine really does anything in terms of the treatment of ADHD, even though a lot of people want to try that. The prevalence, 3 to 7% of the childhood population, 2 to 5% of the adult population. Gender ratio is 3 to 1, with boys more likely than girls. In kids and adolescents, in adults, it's more like 2 to 1. And the disorder has been found in virtually every country has been investigated. Etiologies, what's the cause of it? And this is among a lot of people argue over this. John Roseman, the guy who writes in the paper, says there's no such thing as ADHD. And so you have extremes like that, which I personally believe is very detrimental to those who do have it. Says it's just a behavior issue. I assure you it is much more than that. I'm very good with behavior therapy, with behavior management, and these kids, some of them just do not respond to it. It is more complicated than just that. Genetics and heredity. Twins raised separately. Higher component of ADHD among them, and you can't account for it by the environment. It's more of the genes. One of the highest genetic trait correlations of any psychiatric disorder is estimated to be between 70 and 95% of the degree that you can explain it, which is one of the highest among the psychiatric disorders. One gene has been identified as associated with ADHD, and there's at least 12 teams internationally looking at others. The suspicion is because of the complexity of the disorder, the working memory, the hyperactivity, the inattention, all these factors that come together, that probably there's multiple genes involved. And so they're looking at it and trying to identify those. Once that's identified, then you're going to have a whole new set of medications come on the market, which hopefully will be beneficial, especially for that aspect of working memory. Other things that's associated with ADHD cause prenatal exposure to drugs, alcohol, or cigarettes. Kids who are exposed pre-birth to outside substances, a much higher rate of ADHD. And again, these are kids that is really making the education system pull their hair out, the psychologists, because we don't know how to treat them. I mean, we do not have a technology that works well. We have things that sort of puts a Band-Aid on it sometimes, but it is very challenging. Premature birth weight or low birth weight is also associated with the disorder. Less brain activity in certain areas of the brain, especially the frontal lobe and basal ganglia area of the brain. And there's less activity in certain parts. So there is a very much a biological aspect to it. And it is more than a psychological disorder. It is not something that people can willfully turn off and on. It's much more complicated than that. And when I was in graduate school, I was of the opinion no child should be on medication. Again, my background is very strong behavior modification, behavior management, and I did not believe any child should be on medication. But I went on an internship, worked with a couple of psychiatrists, and saw the impact of medication on ADHD. Now, are there still too many kids on medication? Probably, because I don't think a good assessment is always done. It is important to do a good assessment and have input from multiple sources, teachers, parents. The least reliable, what do you think is the least reliable source of information?
Parents.
The kid themselves. We can do rating scales, get the parents to do one, get the teachers to do one, get the kid to do one. Parents and teachers are way up here, kids way down here. And I used to do those, now I don't even bother to do them. And there's data that backs that up too. I mean, that's not just me, but there's research that backs it up. That ADHD kids are not very reliable historians or good at assessing their own impairments.
Typically, do children who have this, should they be diagnosed by their medical doctor, or they should be taken to a psychologist or a psychiatrist, or who should be diagnosing this?
Any of those folks can. What I'm finding now is most pediatricians are wanting the input from a mental health person, from a psychologist, psychiatrist. Not all, but generally speaking, it's kind of a team approach that they want the psychologist to evaluate the child. They're going to evaluate them medically. They want the psychologist, mental health professional to work with the parents, work with the kid. They're going to handle the medication. So it becomes a team approach. And to me, that's the best way to do it. Now the bad news. This is a slide I hate. More likely to drop out of school, 32 to 40%. Less likely to complete college, 5 to 10%. Have few or no friends, 50 to 70%. Underperform at work, 70 to 80%. Engage in antisocial activities. More likely to experience teen pregnancy. Speed excessively and have multiple car accidents, and depression. There's a lot of studies that back this up, that this population is at risk. And there's been some really good studies that's looked at kids long term that has these conclusions come from. My son had multiple speeding tickets, even to the point that he was offered a job with kind of a delivery service, and they wouldn't hire him when they checked the record. He was in college, and it was great. His major was logistics, and this company was Fastenal, which is one of the logistics companies, and would have been a kind of a stepping stone into his career, and because of his speeding tickets, he couldn't get the job. Yes, sir.
If it is possible that a child that can be diagnosed with this disease is a student that excels.
Can excel? Yes, it is rare, but if they are really smart, they have a way of figuring things out. My observation is that if you have a really bright ADHD kid, they're probably not going to be, it's going to be suspected that they're ADHD, but there will not be enough impairment to justify the diagnosis until they get into 5th, 6th, 7th grade. But even some, very few, probably 1 to 2%, are bright enough and have a milder version of the disorder that they can get through it. Now, if they have a severe, it's going to be very unlikely.
Can this be misdiagnosed by behavior or other alteration of ADHD?
Can it be misdiagnosed? Sure. Anything can be misdiagnosed. Again, it is very important that you try to get multiple sources of information, rating scales, good clinical history, looking at the onset early on, typically before 7. There's a little bit of research now coming out that's beginning to question that maybe there are some kids that it develops later, but I think that most people still say the standard is that it typically you have to see signs and symptoms of it before 7 years of age. And so it can be misdiagnosed, yes. I've seen kids that I felt like were not ADHD that have been diagnosed, that it was just a behavioral issue. And that certainly has to be ruled out. But that's pretty easy to do, because if you put in place a good behavioral program, then there should be a response. If they don't respond to a good behavioral program, then there's something else at work, more biological. And the other thing that I think is important to differentiate from is anxiety. Because if you think about it, if you're anxious, you're going to look inattentive. It's going to be hard to pay attention in class if you're worried about other things. Also, anxious kids can react very defensively with anger and that fight or flight response we talked about 2 weeks ago, where they impulsively react, so they can look impulsive. And so that's one of the disorders that I think you have to, and of course just strictly behavior acting out has to be ruled out. So a good diagnosis, a good assessment is important for them.
I'm an inclusion teacher for kindergarten, and I did see, kindergarten used to be where you had movement. Now kindergarten is more like first grade, and a lot of times parents think it'll be a quick fix, but they don't realize, like with your son, if you don't have structure at home along with the medication, it doesn't do very well.
Right. Yeah. All right. So with this negative, it's amazing what we were talking about earlier is the high rate of noncompliance. And this is one of the biggest challenges, I think, in treating ADHD. First of all, there is no cure, there's only management. You don't give a pill and then the disorder disappears. Education is extremely important. A lot of parents, most parents I see, including myself and my wife, did not want our kid on medication. Who does? Few parents who just want to subdue their kids so that they're not in their hair as much, you know, in a negative way with negative intent. But most parents who care about their kids don't want their kid on medication. And so education is very important. Explaining the disorder, explaining the biological aspect, that it's not just a willful choice, it's not just a psychological disorder. It is a biological, it is a physiological disorder. Education regarding treatment. So I don't want my child on medication. I mean, that's what I typically get. My child's not going to be on medication. Why? Because of the side effects of the medication. Okay? What's the side effects of your child not taking the medication? And that's the question that does not get asked. And the answer is, if a child needs the medication, for every 6 years of school, they're going to lose 1 year academically. And the other part of it is that the kids who need the medication aren't treated or at higher risk for substance abuse than those who receive the medication. You know, I have not seen a kid who I felt like legitimately needed the medication abuse me. I had one kid that we found out was taking one extra one before he went to baseball practice because he found out he could focus better at baseball. This was when he was in middle school, high school. And we got with the physician and changed it the way it was prescribed. He wasn't misusing it any other time. It's just he found out he could focus better in baseball. So it's important to understand that the education, the disorder, in making the decisions, that yeah, it's easy to say there's side effects to the medication, but what's the side effects of not taking the medication? My son, in the 10th grade, asked me if he told me he didn't want to take the medication anymore, he wanted to get off of it. And I said, I want you off of it too. So this is what we're going to do. You stop taking the medication, and if your grades stay the same, you don't get in any trouble, you stay off the medication. Grades drop, behavior problems, you go back on the medication. Okay, fair enough. So 3 weeks or so, grades have dropped to C's and D's, assignments missing, teachers are saying, well, what's going on? He's not the same student. Got back on the medication, you know, graduated with like a 3.7, 3.8 GPA. Went to college, we're taking the medication, came home within a semester. Yes, please.
My question, when you set the conditions for going off the meds or staying, was he as willing to go back on as you would have had him go back on, or did he have any resistance?
Yeah, I mean, because I was giving him a chance and was working together with him, it wasn't a headbutting contest. I made it real clear, I want you off the medication. I hope this works. But we are going to do what works, not what you want, not what I want. I mean, that's problem solving 101 is pick, the definition of a good solution is the one that works, not the one I like. The biggest obstacle to good problem solving is that I don't like what works. I'm looking for a job where I don't have to show up, I still get paid. My patients have not agreed to that. What works is me showing up and doing the work. So we kind of had that discussion ahead of time and including him in it. A lot of kids don't like taking the medication. They like kind of that hyper feeling. And they feel like it kind of robs their personality. And if they're too subdued, they're over-medicated. And some kids are over-medicated. There used to be a formula that came out of Science magazine in the 60s that was you determined the milligrams of medication based on weight. And for years, that was the standard that was followed. But then finally somebody said, let's just start low and work up and see what works the best. And the idea with medication is what is most effective with the least side effects. Dosage doesn't matter. If it's 20 or 60 milligrams, that's not what matters. What matters is what works best with the least side effects. And I've seen some kids where a number of years later, there was a doctor was still trying to follow that formula, and the kid was kind of like this. And the parents took the kid in, and the doctor refused to change the medication, saying, this is what the formula said. I encouraged them to get a second opinion. And they did, and they lowered the dose, and the kid was doing fine in school, but wasn't nearly as zombified as she was on the other medication. So it's really important to educate, understand it's problem solving. You start low. Every kid is different. Some kids use 1 dose, some kids use 2 doses. I've had some parents wake the kid up 30 minutes early, give them the medication, so when they get up, they got the medication in their system because morning time is so difficult. I mean, you just got to have to problem solve and think through all the options, working with the physician and the mental health provider to come up with the best solution.
Do you find that your teenage patients can self-medicate, or do their parents have to administer the meds?
Question is, can teenage patients self-medicate? For the most part, no. The problem is, most of the time, because of genetics, the parents are ADHD. So I'm trying to figure out who's going to remind the parents to remind the kids. But I have a few who, and one of the treatments in terms of organizational skills is external cues. Because internal cues don't work, you need some external cues. So we will do things like get the orange or green or yellow dots and put on the mirror in their bathroom or whatever, and each time they see that, that's a reminder, go take your medication right now. And so you need those external reminders. That's one of the most important things with ADHD is, and again, this is education. Your memory is not going to work well with things that's not important to you. So you're going to have to set up reminders, and getting the kid to buy into that is really important. And so you use a lot of external cues. Cell phones are the greatest thing in the world for ADHD individuals. My son lives by alerts on his cell phone. We were over visiting, and he had an alert go off, and I said, "What's that?" He said, "Oh, that's a reminder for me to go to a meeting about my scholarship tomorrow." And I was thinking, you need a reminder to go to a scholarship meeting? I didn't say it, but that's what I was thinking. But hey, I'm glad he's using the reminders. And so cell phones are great tools for ADHD individuals. The internal working memory just does not work well, so you've got to have the external cues. Posters, signs, alerts. That's one of the biggest things in terms of helping kids get organized. Stimulants, medication stimulants, non-stimulants, and then antidepressants. Some of the non-stimulants is Strattera and Intuitive, and they're great because they stay in your system 24 hours a day. It takes a while to build up. The problem with them is I just find they don't work as well as the stimulants. Let's say they work in 2 out of 10 kids, whereas the stimulants work in 6 to 8 out of 10 kids. And you have to get blood work for liver issues and so forth with them. The other thing is there's studies that show that if you start the stimulants first and try to go to the non-stimulants, there's a lower probability they're going to work. So if you're going to use the non-stimulants and I think it's a great idea to try it. You want to try it before your child is ever on the stimulants. Parent management training, behavior modification, very important part of it. ADHD kids I work with, a lot of it is just spending time working with the parent, setting up structure, emphasizing, reinforcing organizational skills, using external cues, those kinds of things. Organizational skills we've already talked about. Exercise, very important. There's a lot more studies coming out showing that exercise really is beneficial to ADHD individuals, so I highly encourage that. Education and work plans. Coming up with a plan on how to help them most effectively deal with school. The common thing is get them in a room with no distractions, extended test time, and so forth. The problem with that is that any kids you do that for is going to improve their grades. And secondly, which ones are the least likely to use it? The ADHD individual. You give them more time, they don't want more time, they just want to finish. And so it's important to try to make the exceptions, but I just find generally that just hasn't worked well. But like on ACTs and so forth, there's more. I was reading a study about a month ago that showed that any kid who gets extra time and in a less distracting environment raises their scores. So there's kind of a controversy developing around that, and it's getting harder and harder to get ACT and those kinds of folks to agree to it. I mean, you've got to write a legal brief almost to get it done these days.
When you define exercise, does that mean just physical exercise, or that means
Physical exercise, just activities of some sort. In terms of organizational skills, like one of the things we did with my son was a planner. He was disorganized, not getting his work done, getting some bad grades, and so we set up a system. You have to write something for each subject in your planner. If you have no homework, you write no homework. And the idea was that if he went to the trouble to write no homework, he would probably write the correct thing. If it was between nothing and the correct thing, he would take nothing all day long. And so he had to do that, and if he failed to have his planner bring it home, or failed to write in every subject, then he lost electronics for 24 hours. And within 2 weeks, it was amazing how much more organized he was. And even through high school, after a while, I would check it periodically, but not all the time. And so in high school, when I checked it 95% of the time, the planner was still being completed. And the idea is you want to get it to become a habit where they do it without thinking about it. If I have to stop and think, do I want to play video games or do my history project? Guess which one's going to win 90% of the time? The video game. If I just get in the habit, okay, right after I get home, I do my homework and I don't think about it and I just do it out of habit, much improved chance of compliance. All right, I'm going to kind of stop here and just let you guys ask whatever questions you would like, and that's just kind of an overview. Yes, ma'am.
Have you seen very much violence from the ADHD students?
Typically, I don't see violence with just a chaotic family, an unstructured family, a frustrating family, poor behavior management. You increase the frustration level, and so you mix the increased frustration level with the impulsivity and the poor emotional dysregulation. You can certainly see violence. But with the ADHD, if I just have the ADHD by itself, typically not. If there's violence, generally I'll look at more of what's going on within the family, peer influence, those kinds of things.
John, there are a lot of grandparents here. And so let me set up a hypothetical. I have a really neat 6-year-old, 7-year-old grandchild, and I have some sense that there's something going on, ADHD, and I don't want to annoy anyone purposefully, and I'm concerned. Any suggestions for how a grandparent might approach a parent about this issue?
Yeah, I think the first thing you want to try to establish is the idea that there's some impairment with the kid's behavior. They're doing poorly in school, they're having trouble with social relationships, they're having trouble emotionally. And just kind of get to a point of agreement, let's say with the parents on that particular point. And ask the question, what do you think's causing this? And see what the parents' answer is. And if they say, oh, nothing, there's nothing wrong with my child, then walk away because they're not ready to process it. And you're going to do more damage than good at that point. If they say, I don't know, we're just wondering, then you might be able to say, have you considered? I was at a meeting the other night and heard a guy talk about this, and you may want to at least check it out. You want to try to plant the seed without being intrusive. You know, and you know your relationship and how far you can push it too. If there's a history of the person you're talking with getting defensive, you want to go slower. If there's an open relationship that you can talk freely with, then lay it out there. So you got to kind of know the relationship, but it is a very sensitive issue. I knew my son was ADHD from the time he was about 5 or 6 years old. But through some behavior management, we were able to avoid medication. The funny thing was, my mom passed away when she was about 93, and I guess she was 89 or 90, and we were talking about my son one day, and she said, yeah, you know, I didn't say anything, but I was worried about him going to school. I didn't know how he was ever going to sit still in school. And so she had seen it then. So that would be my suggestions. And then encourage education. Get the information. And try to get information. I recommend trying to get information from Russell Barkley. A lot of the information I presented tonight you can find on his website. And it's science. There's a lot of bad information out there on ADHD, a lot of theory and speculation. So try to get the science, and that's a good place to recommend to folks who are considering it to read his work. Yes, ma'am.
Yeah, our daughter is a school teacher, and she had to go into the 3rd grade classes and explain to them that they were not going to have gym because the gym teacher wasn't there and wasn't going to be there for maybe a whole week. He was getting married. And she said this one kid just laid on the floor, screamed and yelled, and said, I want to go to gym. And she said, well, you can't. We got other assignments. She said he was not going to have another assignment. He wanted, that's what school said, and that's what he wanted. And she said, he'll be sad. Everybody else did the assignment, and he just would not do it. So what do you do?
Well, and that's a great example of the cognitive rigidity that we talked about. And you try to get them, you try to distract them and get their mind off of whatever it is that they're thinking about. And there's a number of ways that you can try to do that. You can say, look, we have a problem. You want to go to gym, and there's no gym teacher, there's no way we can go. So we have a problem here. What do you think we could do? And a lot of times those kids, they get stuck here in this part of the brain, and you try to get them to at least here where there's some form of thinking going on and trying to get them to think. Or you try to distract them to thinking about something other than the gym. And sometimes when they're already in that mode, it is very, very difficult. Yeah. Yeah.
Well, she said she tried to explain to him that, she tried to explain to him, as you get older, there is always going to be a change in your schedule, and you're going to have to adjust, and, that's just life.
Yeah.
Things are never going to go smoothly, even if you have a schedule.
And it is very challenging, and at home, Russell Barkley's philosophy on parenting is act, don't yak. One of the issues that I see with parents these days is they talk too much. And rather than saying, this is a rule, this is a consequence, if you choose to do this, this is what's going to happen. And talk to them when things are going well, not when you're in the middle of a non-compliance issue. That is not the time to talk. Because you may be inadvertently reinforcing the behavior with attention. And I observed this with my daughter. We have 3 grandsons, and they're full speed ahead, all, go, 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 go. So one of them misbehaved at the dinner table. So my son-in-law and my daughter went into the bedroom with him to talk with him and left the 2 who were behaving alone. Yeah, my recommendation would be send the one who's misbehaving out by himself and start laughing and cutting up and having a good time with the ones that are behaving. And we attend to the person.
Send you into the room with one of them.
Yeah. Well, I was hoping that the reason they did that was because we were sitting there, but I don't think that was the case. I think that was the way things operated, was the person, it's the Hollywood model. Bad publicity is better than no publicity at all. So if I can get your attention through misbehavior, that's still very powerful with kids.
Do you tell your daughter that? Given your position?
No, because I was not asked.
Okay.
And that's one of my rules with my adult children is if I'm not asked, I do not tell. Verse in Matthew, do not throw your pearls at pigs. And the pearls we're talking about is pearls of wisdom. You have these pearls of wisdom that you want to throw out, but it's going to be trampled by the pig. So I don't recommend it unless you're asked for your input.
Before you started your talk tonight, I was discussing at this table with my fellow grandparents that when we went to elementary school in the 30s and 40s, we do not remember children who were very disruptive. Everybody in the class knew who was going to make A's and B's and C's in the class, but we do not remember any students who were disruptive in the way that we're talking about tonight. Could you speak to that?
Yeah. Notice the percentage here. And a lot of people think this percentage is much higher because of the publicity. But it's not. It's talked about more openly. I think that's one of the factors. And so people are more willing to acknowledge it. Now, I'm sort of old school in this sense that when you create structure and expectations, I think you get higher rates of compliance. And we have lost a lot of that structure and expectation. And I think that's one of the problems. ADHD kids respond very well to immediate consequences. If it is a delayed consequence, they do not respond as well. My wife was a teacher in a school where there was 9 steps to a discipline action. That is not immediate consequences. And if I know as a kid I have 9 steps, there ain't no way I'm going to comply. And back then, there was more of an immediate consequence and a different set of expectations, and I think that's a factor. And I do think it's an issue with the structure that we have these days. Same with the court system, yeah. And, you know, learning theory is the most effective parenting techniques. I mean, that's where we get the best data for developing behavior modification programs. And learning theory emphasizes consistent, immediate consequences. And what we see today is everything but that. We're going to talk to them. And 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 it makes things worse. Count to 3. Count to 5. Well, I counted kind of fast to 3, so I'm going to count slower to 5 to give them a better chance. Yeah, and I do think that's part of it. But now, with that said, it is important to have empathy. The parenting model that I really recommend in a succinct fashion is empathy for the emotions, accountability for the behavior. And I had the accountability for the behavior, but I didn't have the empathy for the emotion growing up. And I think that's a much better model. I think it would have helped me to have had some empathy for what I was feeling and so forth. Because you say, I understand how you feel, that doesn't mean you're saying it's okay to act on those feelings. And so to say, I understand you don't want to take out the garbage. However, if you choose to not take out the garbage, you will not be using any electronics for 24 hours.
When our kids were younger and we had pets. Oh, sorry. When the kids were younger and we would have pets, I alternated who walked the dog and who took care of the cat for the day. And once in a while our son would say, oh, I don't want to, I'm tired, I don't want to walk the dog. I said, okay, open the door, let the dog go. If the dog gets hit by a car, then we won't have to walk him.
Yeah. Yes, ma'am.
If a child is given Ritalin because they are diagnosed as ADHD, and they don't have ADHD, it would make them look like they have ADHD, right?
Because it's a stimulant. Then they would start acting as if they're hyperactive. Is that right?
It would depend on the dosage and the effect. I mean, you can take, speed, and it's going to help everyone focus. It was used widely in college. And so it's not necessarily that you just become jittery. Now, if you take too much, you will. So, not necessarily.
Okay.
It depends on the dosage, the amount, and so forth.
Can you diagnose ADD by brain scans?
I do not know of any data on brain scans, but you can with EEGs.
Yeah, you alluded to that.
And the difference between the beta and the theta wave. And there's a data set that if it's greater than such and such, then there's a 95% probability. I look for the scans to be used more and more in the future. I think most mental health disorders in the future will be diagnosed by functional MRIs or some other new technology that comes forward.
Thank you.
All right. Thank you for your kind attention.